This is me Arzu here and I welcome you to my channel Mr. Teeth, where your dental concept get dissected. So this is our part 3 video of the periodontal ligament, and in this video we will be covering the remaining topics of this chapter. In the part 2 video of the periodontal ligament, we just discussed with the different kinds of the cells that are present in the periodontal ligament. Okay, in the first paper of second video we discussed the composition. Okay, we studied the flow chart of the composition of the periodontal ligament. So among the composition also we have just discussed with the cell. Okay, and we have left the another portion, that is extracellular substance, for the next video, and that extracellular substance we will be discussing in today's video. Okay, so as you can see here in this flow chart, okay, so this flow chart I have shown in the previous video. Okay, so periodontal ligament have the cells and the extracellular substance, and in the cells also we have five other different types of the cells. Okay, so we have discussed with those cells, and now we will discuss with this extracellular substances. Okay, and in these extracellular substances we have two major components. One is fiber and another is a ground substance. Okay, so in the fibers also we have collagen fiber, another is elastic and oxytocin, another is reticular, secondary, indifferent fiber plexus, and the ground substance we have glycosamine glycans, proteoglycans, and glycoproteins. I think you remember it. Okay, so now, okay, so we will start with the fibers. Okay, and also the fibers we will start with the collagen. Okay, so as I have written here in the first point, okay, so other topics are also mentioned here. Okay, so surface fiber, intermediate plexus, structure present in the connective tissue, and the exchange. Okay, so today we will complete this periodontal ligament. Okay, so now let's start our topic. Okay, so in this first point, as you can see here, so collagen. Okay, so first we will discuss with the collagen, and the collagen, it is gathered to form the bundles approximately 5 micrometer in diameter, and those bundles are principal fibers. Okay, so principal fibers are just the bundles. Okay, so they are just the bundles of the collagen fibers. Okay, so the collagen fibers are accumulated and forming the bundles, and those bundles are called the principal fibers, and collagen, and the diameter of those bundles, okay, is 5 micrometer in diameter. Okay, you can remember this data, this is important. After that, in the next point, as I have written here, in each collagen bundle subunits are present, and those subunits are called collagen fibrils. Okay, so collagen fibrils are the subunit of those collagen bundles, those principal fibers. Okay, after that, those collagen fibrils have transverse striations, okay, that is 64 nanometer periodically, with which are caused by overlapping arrangements of the tropocollagen molecule. Okay, so from this point you should just remember these 2 points. Okay, so transverse striation is present there. Okay, so you should just remember that there is a bundle of the collagen fiber, and that bundle is called principal fiber, and those principal fibers have the subunit called collagen fibrils, and in those collagen fibrils we have the transverse striations periodically at every 64 nanometer, and those transverse striations are present due to the overlapping arrangements of the tropocollagen molecule. Okay, so you should remember this overlapping arrangements of the tropocollagen molecules. After that, in the next point, collagen fibril diameter of the mammalian periodontal ligament, okay, so is the mean diameter is 45 to 55 nanometer. Okay, so this is also data you can remember. So this collagen fibril, okay, in the mammalian periodontal ligament, it is 45 to 55 nanometer, and the diameter of this principal fiber is 5 micrometer. Okay, now the main type of collagen that are present in this principal fibers are type 1 collagen and type 3 collagen, and the ratio is 3:1. Okay, so type 1 collagen is more and type 3 collagen is less. Okay, after that also type 5, type 6, type 4, and type 7. Okay, so these types of collagens are also present in this principal fiber. Okay, so I think you can remember this all those data. Okay, and the concept. Okay, so you should just think principal fiber is not anything but it is a bundle of the collagen fibers. Okay, and the subunit of those principal fibers is called collagen fibrils, and those have transverse striations, and these are formed due to the tropocollagen molecule overlapping arrangements. Okay, and it is formed by type 1 and type 3 collagen. Okay, So we have completed this, and in the next part I have written here about the surface fiber, but I will discuss this later after when we will complete this about fibers and the ground substance. I think to add this surface fiber here, because this is also related to the fiber, okay, but I will discuss this uh, later, okay, in this video itself. Okay, so now we will start with this principal fiber group. Okay, so this is very important topic of this chapter, periodontal ligament. And if you're gonna ask me the question, okay, so tell me the most important topic of this chapter, then I would reply about this principal fiber groups. Okay, so let's discuss this properly, and I have prepared the table. Okay, and this table I have taken from the Orbans. Okay, so I will clear all your concept, okay, from this chapter. Okay, so you should now uh, focus on this topic. Okay, so just listen me. So our first fiber is a alveolar crest group of fiber, and the origin and insertion is present in the next column. After that there is a function. Okay, so alveolar crest group means the name signifies. Okay, so alveolar crest means the fiber must originate from the alveolar crest. Okay, so alveolar crest group means it extends obliquely from the cementum just beneath the junctional epithelium to the alveolar crest. Okay, so it extends obliquely. Okay, so I'll show you the picture, then it will be more clear. So this is a junctional epithelium and this is a cementum. Okay, so it extends from the cementum to the alveolar crest. Cementum just beneath the junctional epithelium to the alveolar crest. Okay, and similarly in the next point also, cementum over the alveolar crest to the fibrous layer of the periosteum covering the alveolar bone. Okay, so you can also remember this point, but the most important point is this. Okay, after that the function of this alveolar crest group fiber is that it resists the tilting, intrusive forces, extrusive forces, and rotational forces. Okay, so these are the four different kinds of the forces, okay, that is resisted by this alveolar crest group of fiber. Okay, and you can remember this. Tilting means when the occlusal force or the masticative force is applied on a tooth, then tooth tries to just tilt. Okay, so it just resists those tilting forces. Intrusive forces means towards the inside. Okay, so towards the oral cavity side force, and extrusive means outside the oral cavity. Okay, so outside the arch, that will be more appropriate. Okay, so if this is a tooth arch, okay, if this is a maxillary arch, and if the force is applied, okay, in such a way that teeth is being pushed toward outward, okay, then it is extrusive forces, and if the teeth is pushed towards inside, then it is a intrusive forces, and also the rotational force. Okay, so these are the four different kinds of the forces, you can remember that. After that, our next fiber is a horizontal group of the fiber. So it is limited to coronally 1/4 of the PDL space. Okay, so horizontal group of fiber. Okay, so I will show you this. Horizontal group of fiber means they are just horizontal. Okay, okay, so they are just horizontal, extending from the cementum of the tooth to the alveolar bone. So this is a horizontal group of fiber. They are limited to the, okay, coronal 1/4 of the PDL space. Okay, so coronal 1/4 of the PDL space. So coronal PDL space is covered by this horizontal group. After that, the origin and the insertion. Okay, so it runs horizontally between the cementum and the alveolar bone, and it is perpendicular to both of them. Okay, so this is simple to understand. After that, it resists the horizontal and the tipping forces. So these two forces are resisted by those horizontal group of fiber. After that, the oblique group. Okay, so in the oblique group, the most numerous and occupy 2/3 of the ligament. Okay, so this oblique group is one of the most numerous. Okay, so it is most numerous type of fiber present in the periodontal ligament, and it occupies about 2/3 of the ligament, and it extends into the alveolar bone coronal to their attachment to the cementum. Okay, so this oblique group. Okay, so this is oblique group fiber. Okay, so these are the oblique, so oblique fiber, so they are most predominant fiber of this periodontal space, and they just extend from the cementum below this horizontal fiber towards the alveolar bone. Okay, coronal to their attachment. Okay, now there is the vertical and the intrusive forces. Okay, so you can also remember this. So here is horizontal and the tipping forces. Okay, and here is vertical and the intrusive forces. After that, our fourth group of fiber is a apical group of fiber, and it is not seen in completely formed root. Okay, Okay, so it is not seen in the incompletely formed. Okay, so it is mostly seen in the completed roots. So that in apical group, so this is very easy to understand. So apical group means it extends from the root tip and radiate through the periodontal ligament space into the fundus of the bony socket. Okay, so apex means it is not clear in this picture, but I will show you the another picture, then there you will be clear. Okay, so apical group means from the apex. Okay, if this is a tooth, so just think this is a not okay, I will show you here itself, then it will be clear. Okay, so just think this is a tooth. Okay, so and this is a crown and this is a root and this is the apex of the root. Okay, so from the apex to the alveolar bone. Okay, so this fiber are the apical group of fiber. Okay, after that it resists the luxation, prevent the tooth tipping, protects the delicate limb and the blood vessel and the knob traversing the periodontal space. Okay, so they just resist the luxation, prevents the tooth tipping and protect the delicate limb, blood vessels. Okay, and the knobs traversing the periodontal space. Okay, after that interradicular group of fiber. Okay, so interradicular group of fiber are that fiber that is lost if the forcation area is exposed. Okay, so this interradicular group of fiber are present at the forcations. Okay, so these are mostly forcations means it must be a posterior tooth where there is a two roots. Okay, so if this is a two roots of the tooth, then in this portion, okay, so in this portion there is a fiber that is interradicular group of fiber, interradicular portion of the tooth which is present. After that it extends into the cementum from the crest of the interradicular septum of the multi-rooted tooth. Okay, so same thing is written here. After that function, resist tooth tipping, torque and the luxation. Okay, okay, so this is a proper table of the principal fiber groups. Okay, and I will show you the picture one, then you will be more clear. So for the picture, okay, so I think it is visible here. Okay, so this is a principal fiber groups. Okay, and I have taken this picture from the Google. Okay, so you can see here. Okay, so this red color fibers. Okay, so those red fibers are the alveolar crest fiber. Okay, so they are the alveolar crest group of fiber. After that, okay, so there we can see the horizontal fiber, and that occupy the 1/4 of the PDL space coronal. Okay, coronal 1/4 of the PDL space. Okay, after that, okay, beneath that we can see the oblique fiber. Okay, so those oblique fiber, so this is a oblique fiber. Okay, so this is a oblique fiber that is running obliquely from the alveolar bone periosteum to the fibrous periosteum to the cementum of the tooth. After that, this beneath oblique fiber you can see this apical group of fiber, and here you can see the interradicular group of fiber. Okay, so we have seen all those different 5 types of the principal fiber groups. Okay, okay, now we will discuss with the another topic. Okay, so that is also one of the important topic of this chapter, that is gingival group of fiber. Okay, so these are also the groups of fiber, okay, that are supplementing the function of the principal groups of fiber. Okay, okay, so principal fiber groups, they are supplemented by these gingival groups of fiber. So they are the secondary fibers of the periodontal ligament seen in the lamina propria of the gingiva that supplements the principal fiber to maintain the functional integrity of the tooth. Okay, and one thing you can remember. Okay, so in this principal fiber, okay, so there is a connection between the tooth, direct connection between the tooth and the alveolar bone. Okay, so these fiber make the direct connection, but those gingival group of fiber, there is no direct connection between the tooth and the alveolar bone. So they are just present in the lamina propria of the gingiva, and those fiber, okay, they just supplement the function of the principal group of the fiber. After that, our first gingival group of fiber is a dentogingival group. Okay, so dentogingival groups of the fiber means they are present at the cervical portion of the cementum to the lamina propria of the gingiva. Okay, so I will show you the picture, then you will be more clear. Okay, so I have also found this apical group. Okay, so apical group means from the apex to the alveolar bone. So these are the apical group of the fiber, and here you can see. Okay, so as we are discussing with this dentogingival, Okay, so dentogingival fiber, as I was showing the picture of this gingival group of fiber. Okay, so dentogingival fiber means dento means teeth and gingival means gingiva. Okay, so this fiber connects the tooth from the gingiva. Okay, so the name signifies. Okay, so you can easily remember this. So dentogingival means cervical portion of the cementum to the lamina propria of the gingiva. After that, our next gingival group of fiber is a dentoperiosteal, means tooth and the alveolar bone. Okay, so the name signifies here. Okay, so the here you can see the dentoperiosteal fiber means dentoperiosteal means tooth and the alveolar bone. So this is a dentoperiosteal group of fiber. Okay, so you can see here this is a dentoperiosteal fiber. Okay, so cementum to periosteum of the alveolar crest and of the vestibular and the oral surface of the alveolar bone. Okay, so just simply you should know that cementum. Okay, so cementum of the tooth with the periosteum of the alveolar crest or the vestibular and the oral surface of the vestibular means towards the vestibule and oral means towards the oral cavity. Okay, so I think you are clear in this. Vestibule means the space between the lips and the gingiva. Okay, so that is the vestibular side. So this is a dentoperiosteal. Okay, so third gingival group of fiber is a alveolo-gingival, and this alveolo-gingival means from the alveolar bone to the gingiva. Okay, so crest of the alveolar bone to the lamina propria of the gingiva. Okay, so I will show you the picture. So in the picture, as you can see here, alveolo-gingival means from the alveolar bone to the gingiva. Okay, so this is a alveolo-gingival group of fiber. Okay, and this was the dentogingival fiber. This was the dentoperiosteal fiber. Okay, so this is very easy to understand. You just have to remember the picture. Okay, after that, circular group of fiber are arranged in the gingival connective tissue encircling the tooth like a collar. Okay, so this is also very simple. You shouldn't have to be confused in this. So you can see here. Okay, so those fibers. Okay, so just think this is a tooth. Okay, and I am seeing from up. Okay, so this is it cusp, so this will be more better. So this is a cusp. Okay, this is a root of the tooth. So if you will cut this tooth like this, okay, in transverse section, then you can see the in the gingiva of the tooth, you can see the fiber running encircling the tooth. Okay, so those fibers are the circular group of the fiber. Okay, I think you are clear in this. So fiber arranged in the gingival connective tissue encircling the tooth. Okay, and in so this is not a transverse section, this is a longitudinal section. So we are seeing the gingival circular fiber in such a pattern. Okay, but if you will cut the tooth in a transverse section, then you can see the gingiva circular fiber encircling the tooth. So those are the circular fiber. After that, our last type of fiber is a transseptal fiber or the transalveolar fiber. So some of the surface fiber pass through the alveolar process, and these fiber continue as the principal fiber of the adjacent periodontal ligament. Okay, so this is not much difficult to understand. You just have to remember. Okay, so transseptal or the transalveolar fiber. So transseptal or the transalveolar fiber means that gingival group of fiber that connects the that connects the one periodontal space to the adjacent periodontal space of the another tooth. Okay, so it just penetrates the alveolar bone and move and comes outward in the another periodontal space. Okay, so just I'll draw a schematic diagram. Okay, so just think this box is a periodontal space of the one tooth, and this is a alveolar bone. Okay, so this is a alveolar bone, and this is a periodontal space of the another tooth, and here you can see the one tooth, and here is a one tooth. Okay, so the periodontal fiber. Okay, so this transalveolar fiber is present. Okay, so those fiber, the principal group of fiber, they just I'll draw with another pen, then it will be clear. Okay, I usually draw the schematic diagrams. Okay, so to make clear all the concept, so you should just catch it out. Okay, so just think this is a tooth. Okay, so this is a tooth, this is a tooth here, and this is also tooth here. Okay, and this is a alveolar bone here, and this is a periodontal space here. So you know that principal group of the fibers. Okay, any principal group of the fiber. Okay, it connects the tooth from the alveolar bone. So now those fibers, these are connecting the tooth and the alveolar bone, they just penetrate into the alveolar bone. Also those fibers penetrate into the cementum. So those penetrated, okay, so those embedded portion of the principal group of the fibers are known as surface fiber. Okay, so those surface fibers sometimes pass through this alveolar bone. Okay, so just think this is a one principal fiber and it is penetrating here in the alveolar bone. So this is a surface fiber and they just penetrate this alveolar bone and comes outside, and again it forms the another principal group of the fiber in another periodontal space. Okay, so this fiber that is being transferred from the one periodontal space to the another periodontal space by penetrating the alveolar bone. Okay, so this is the transseptal. Okay, so this is a transseptal or the transalveolar, means trans means throughout the alveolar bone. Okay, so the name also signifies the same thing. Okay, so you should remember in such a pattern. Okay, so dentogingival, dentoperiosteal. So there you can just imagine like this way. Okay, so I will draw a simple diagram here. Okay, okay, so this make the triangle. Okay, so make the triangle. Okay, so this is a dentogingival. Okay, so dentogingival means this is a gingiva, this is a tooth. So this is a tooth, this is a gingiva, and this is alveolar bone. Okay, so tooth and the gingiva, dentogingival. Okay, similarly gingiva and the alveolar bone, this is alveolo-gingival. Easy. Okay, after that the tooth and the alveolar bone, so that is a dentoperiosteal, and another is a circular group. Okay, so you can remember this uh, by any way. Okay, so circular group means just encircling, and this transseptal, okay, which is a fifth one, it just it just traverses the alveolar bone and comes in the periodontal space of the adjacent tooth. Okay, so I think you can remember it now, and it is very easy to remember. After that, our next topic is the reticular fiber, and also I think you are clear in this topic. I have shown you the picture. Okay, so this is dentogingival, alveolo-gingival, this is dentoperiosteal, this is circular group of the fiber, and if the fiber, okay, just penetrate the alveolar bone and comes into the, okay, so it, if it comes into the space of the another periodontal ligament space, another tooth, adjacent tooth's periodontal ligament space, then that is called transseptal fiber. Okay, this, after that I will discuss with this reticular fibers. Okay, so these reticular fibers are the fine immature collagen fiber. Okay, so they are fine immature collagen fiber with the organophilic. Okay, so this is important here, organophilic staining properties, and are related to the basement membrane of the blood vessel and the epithelial cells which lie within the periodontal ligament. Okay, so this is a reticular fibers. Okay, reticular fibers means the fiber immature collagen fiber that are organophilically stained. Okay, organophilic staining properties they contain. After that, they are related with the basement membrane of the blood vessel and the epithelial cell which lie within the periodontal ligament. So this is important point to remember this reticular fiber, and it is mostly composed of this type 3 type of collagen. After that, our another fiber is a secondary fiber, and in secondary fiber, okay, so it is located between and among the principal fibers. Okay, so secondary fibers means they are secondary, okay, to the principal fiber, as they are secondary to the principal fiber. So gingival group of the fibers were also secondary to the principal fiber, and they are just supplementing the functions of the principal groups of the fiber. Similarly, these secondary fibers are also secondary to those principal fiber located between the principal fiber, and they are non-directional and randomly oriented, traverses the periodontal space coronoapically, and are often associated with the paths of the vasculature and nervous element. Okay, so they just traverse the periodontal space. Okay, they just traverse the periodontal space coronoapically, mostly coronoapically, and often associated with the blood vessels and the nerve tissue. Okay, so that is the secondary fibers. After that, our another type of the fiber is a indifferent fiber plexus. Okay, so indifferent fiber plexus means they are the small collagen fibers associated with the larger principal fibers of the periodontal ligament. Okay, so small collagen fibers, so this point is important for this, small collagen fiber which are associated with the larger principal fibers of the periodontal ligament, and fiber runs in all the directions without a particular orientation, and which is just similar with that of the secondary fibers. And in the third point, some author also consider it as an artifact produced by the preparation. Okay, Okay, so those three fibers are not bit important, but you can remember in reticular fibers we have fine immature collagen fiber with organophilic staining. Okay, this much is enough, and type 3 collagen is present there. In secondary fiber we have it is located between the principal fiber. They are non-directional and randomly oriented, and they traverse the periodontal space coronoapically associated with the vasculature and the nervous element. And in different fiber plexus, small collagen fibers are present among the associated with the larger principal fiber, and they are some of the author tell it as an artifact. Okay, so they are also oriented in the random direction. Okay, so we have completed all those three different kinds of the altogether we have completed four different fibers. Okay, so collagen, reticular, secondary, and indifferent fiber plexus, and one fiber that is left is elastic fiber. Okay, so elastic fiber means, okay, so these are also very important fibers of this periodontal ligament. So elastic fiber mostly it is containing three different types of the elastic fiber. Okay, so three types of the elastic fiber are there, which are histochemically and ultra structurally different. Okay, so they are histochemically and the ultra structurally different elastic fiber. And in elastic fiber also in those three type we have classified. Okay, so one is a mature and another is a immature. In mature we have elastic, and in immature we have elastin and oxytocin. Okay, so these are the immature, and altogether we have three different kinds of the three different kinds of the elastic fiber, which are histochemically and ultra structurally different. Okay, after that in elastic, as I have written here, okay, so this also I have taken from the Orbans. Okay, so there is a table in Orbans, so same thing I have written here. So in the first point, microfibrillar component, okay, surrounding an amorphous core of the elastin protein. Okay, so at the core, so if this is a core of the elastin protein, then surrounding it, okay, so in the periphery of this elastin core, okay, so elastin is a protein. Okay, so elastin protein makes the core, and around the core there is a microfibrillar. Okay, so microfibrillar component surrounds those core. Okay, so that is a elastic uh, fibers. Okay, after that another point, present only on the walls of the afferent blood vessel. Okay, so this is very important. Okay, so it is only present on the afferent blood vessel wall, and that constitute the elastic lamina of the larger arterioles and of the arteries of the greater caliber. Okay, so this is also another point of this elastic fiber. Okay, so now our another fiber is a immature type of elastic fiber, and in immature we have elastin and the oxytocin. So in elastin we can see here seen as a bundles of the microfibrils embedded in the relatively small amount of the amorphous elastin. Okay, so bundles of the microfibrils, they just get embedded, okay, embedded in the relatively small amount of the, here they are surrounding, okay, surrounding an amorphous core, but here they are just getting embedded into the elastin protein. Okay, amorphous elastin. After that they are present in the fibers of the gingival ligament. Okay, so gingival ligament means I have discussed previously those dento gingival, dento periosteal. Okay, so those are the gingival ligament. Okay, so in this oxytocin, it contains only the microfibrillar component, which is of 0.5 to 2.5 micrometer in diameter, and there is no presence of the elastin protein. And another point, as I have written here, it runs axially, one end being embedded in the cementum or the bone, and another in to the wall of the blood vessel. Okay, so it just connect the blood vessel with that of the alveolar bone or the cementum. Okay, so that is present in the oxytocin. Okay, okay, so once again I will just recite all those points of this elastic fiber, so you will get the proper concept, proper overview of this elastic fiber. Okay, so in the elastic fiber you have to remember that there is one mature, another is a immature. So in mature we have elastic, another in immature we have elastin and the oxytocin. In elastic we have the microfibrillar component that is surrounding the elastin protein core, and in the elastin we can see the bundles of the microfibrils, okay, which are embedded in the elastin protein. They are not just surrounding, but they are embedded into those protein. After that there is oxytocin, and in oxytocin there is no elastin protein, there is just a microfibrillar component which is of 0.5 to the 2.5 micron in diameter. and they are present only in the wall of the apparent blood vessel and in the elaunin. Okay, so they are present in the fibers of the gingival ligament. Okay, and in this oxytocin, okay, so they just run axially, and they are one end of this oxytocin fiber is attached to the cementum or the tooth of the cementum or the bone of the alveolar bone of the tooth. Okay, and another side is attached to the wall of the blood vessel. Okay, so I think you are now clear in this elastic fiber. Now I have discussed with the ground substance. Okay, so in the ground substance, 70% of the water is significant, or 70% water is present in this ground substance. Also, there is presence of the glycosamine glycan, proteoglycans, okay, and glycoprotein. Okay, so those three are the major component of this ground substance. And here, as you can see here, all the anabolites and the catabolites pass through it, and other function include iron and the water binding and exchange, control of the collagen fibrillogenesis, and fiber orientation and the binding of the growth factor. Okay, so those are the function of the ground substance. And after that, gags. Okay, so hyaluronone, dormatin, chondroitin, and heparin sulfate are the major glycosamine glycan. And in the proteoglycan, we have two major types, that is dormatin sulfate and chondroitin sulfate, and dormatin sulfate hybrid is present there. Okay, so just have to remember we have three major component: gags, proteoglycan, and glycoprotein. Okay, so in gags we have hyaluronone, which is in the large volume of the periodontal ligament, and dormatin, chondroitin, and heparin sulfate are the other, okay, that are present in the periodontal ligament, which comes under the glycosamine glycan. And the proteoglycans, okay, so we have dormatin sulfate and chondroitin sulfate plus dormatin sulfate hybrid. Okay, so that is present in this proteoglycan section. And proteoglycans are the gags that are attached to the protein core. Okay, so they are just attached to the protein. Gags that are attached to the protein are called proteoglycan. Okay, protein and the glycans. After that, in the another point, some leucine rich proteoglycan including the fibromodulin and porlican are present in the periodontal ligament. Okay, so you should remember this fibromodulin and the porlican. Okay, so this is MCQ question. Okay, they can ask you in MCQ. So leucine rich proteoglycan means fibromodulin and the porlican are present in the periodontal ligament. After that, predominant glycoprotein in the ground substance is a fibronectin. Okay, and it promotes the attachment of the cell to the collagen fibrils, also involved in the cell migration and the orientation. Okay, so predominant glycoproteins in the ground substance is a glycoprotein is also third component of this ground substance of the periodontal ligament. So in the glycoprotein we have fibronectin, which is predominant. Okay, and this fibronectin, it just promote the attachment of the cells to the collagen fibrils, and also it involved in a cell migration and the orientation. Okay, so they just attach the cell with the collagen fibrils, and they just involve in the cell migration and the orientation. After that, in the last point of this ground substance, composition of the ground substance vary with the developmental stages. And this is also a very important question that can be framed into the MCQ. So with the developmental stages of the tooth, okay, there is different composition of the ground substance. So during the eruption, there is a large amount of the proteoglycan in the periodontal ligament. Okay, so you can remember this. Okay, so we have completed this ground substance, and after this ground substance, okay, I will again take you to the first paper. And in the first paper, as I have mentioned about the surface fiber. Okay, so I am going in the flow. Okay, I am just explaining all those points that I have written here serially. So we have completed this extracellular substances, fiber, and the ground substances, and after this we are reading this about the surface fiber. Okay, so in this surface fiber, as you can see here, okay, so their embedded portion of the fiber are called the surface fiber. Okay, so this I have told previously. Okay, so they are just the embedded portion of the fiber, and they are more numerous but smaller at their attachment into the cementum than the alveolar bone. Okay, so they are more numerous and but smaller to add their attachment into the cementum than alveolar bone. Okay, so in cementum they are more numerous but smaller. Okay, more numerous but smaller at their attachment to the cementum. And this is important question, MCQ question. Okay, so this is a MCQ question they can ask you. Okay, so they are more numerous and smaller at the side of cementum. Mineralized part of the surface fiber in alveolar bone appears as a stops. Okay, so in stops, okay, so they just appears like a stops. After that, few surface fiber pass uninterruptedly through the bone of the alveolar process. They are called transalveolar fiber, and I have discussed with this previously. After that, this fiber get entrapped in the alveolar bone either during the development of the interdental septum or by the bone depression at the alveolar crest. Okay, so same thing about the transalveolar fiber. Okay, so this fiber get entrapped in the alveolar bone either during the development of the interdental septum or by the bone deposition at the alveolar crest. Okay, so that is about the surface fiber, and you can go through those points, okay, once again. But just the concept that you can take from the surface fiber is that, okay, so they are just a embedded portion of the fiber, whether in a cementum or in the bone. Okay, so we have completed the surface fiber, and most of the time, okay, they used to ask as a short note on this surface fiber. Okay, at that time you should just mention the points of the surface fiber, like that they are embedded. Okay, similarly in another point you can write they are most numerous and but smaller in attachment at the side of the cementum than that of the bone. Okay, so you can write a little bit about the transalveolar fiber, okay, and how they are formed. Okay, so you can just mention in such a way. After that, our next point, intermediate plexus. Okay, so most of the students used to have confusion in this intermediate plexus. Okay, but you just only have to think that those intermediate plexus, okay, so they are the plexuses of the fiber at the middle of the bone and the cementum. Okay, so I have written here, so it is believed that periodontal ligament, okay, from the cementum and the bone joins in the mid region, giving a rise to a distinct zone that is called intermediate plexus. Okay, so this point is enough for this concept. Okay, so intermediate plexus, so they are just the plexuses of the fiber that is formed at the mid region between the bone and the cementum. Okay, okay, after that, the another important point of this intermediate plexus is that they are highly metabolic. Okay, so high metabolic activity is present in this plexus region, and there are also artifact arising out from the plane. Okay, some of the author used to tell that this is an artifact, okay, similar like that of the indifferent fiber. Okay, so indifferent group of fiber as we have discussed here. Okay, so I will show you once again, then you will be more clear. Indifferent fiber plexus. Okay, so in different fiber plexus there are also artifacts sometimes. Okay, some of the author used to tell artifacts. Okay, so similar here in indifferent intermediate plexus. Okay, they are also an artifact. Okay, so some of the author used to tell they are artifact. After that, principal fiber lose their distinct, okay, distinct organized bundle structure and become wavy, randomly oriented, and fuse with the indifferent fibers. Okay, so okay, so in this intermediate plexus, okay, you just have to remember those 4 points. Okay, so those 4 points are, okay, so they are the plexus, they are the region, okay, that is formed at the mid region between the cementum and the periodontal ligament. Okay, so the fiber from the cementum and the fiber from the periodontal ligament, they just intermingle at the mid region. Okay, and they form the plexus that is called intermediate plexus. Okay, and the fiber at this region are disorganized. Okay, so the bundle structure is not distinct, they are disorganized, and they form the wavy and randomly oriented. After that, another main point of this intermediate plexus is that they are metabolically active. Okay, they are metabolically mostly they are most active metabolically. After that, some of the author also used to tell it as an artifact. Okay, so you shouldn't have to be confused in this intermediate plexus and in another indifferent fiber plexus. Okay, so both are the plexus. Okay, and this is metabolically active, but those indifferent fiber plexus are not so. Okay, so that is a difference between both two. Okay, after that, the structure present in the connective tissue. Okay, so this is also a question that can be framed into the short question. Okay, So our first structure that is present in the periodontal ligament connective tissue is the blood vessel. Okay, so periodontal ligament have the abundant, okay, vascular supply. Abundant vascular supply is there. Arterial supply is derived from the inferior and the superior alveolar artery. Okay, so inferior and the superior alveolar arteries to the mandible, okay, and the maxilla respectively, and reach to the periodontal space, periodontal ligament from the three sources, and those three sources are this. Okay, so the first source is branches in the periodontal ligament from the apical vessel that supply the dental pulp. Okay, so from the apical vessels, okay, they used to get the branches. Another branches they get from the intra-alveolar. Okay, intra-alveolar vessel means the vessel that is present inside the alveolar bone. Okay, so intra-alveolar vessel, these branches run horizontally, penetrate the alveolar bone and enter the periodontal ligament. And in another point, branches from the gingival vessel enter from the coronal direction to the periodontal ligament. Okay, so gingival fiber means from the gingiva enters into the periodontal ligament from the coronal portion. Okay, okay, so we have completed all those branches, okay, and how they, all those branches of those superior and inferior arteries, okay, alveolar arteries, and how they reach to the periodontal ligament, and the venous supply of this periodontal ligament. Okay, so they just accompany their counterpart. Okay, a counterpart means artery, so they just accompany their counterpart arteries, and channels are larger in diameter with a mean average of 28 micrometer. Okay, you can remember this data. After that, in another point, receive the blood from the capillary network and also a specialized shunt called glomeruli in the periodontal ligament. Okay, so those venous drainage, okay, so they just drain the blood from the capillary network, and those capillary network are having a specialized name, and that is called glomera. Okay, glomera is a specialized name. Okay, so now another content of this connective tissue is the lymphatic drainage, and in the lymphatic drainage, so the network of the lymphatic vessel follows the paths of the blood vessel. Okay, so network of the lymphatic vessels follows the path of the blood vessel. And another point, flow is from the ligament toward and into the adjacent alveolar bone. Okay, so flow is from the ligament towards the alveolar bone, okay, adjacent alveolar bone. And in the third point, it drains into the lymph node of the head and neck. Finally, it have to be drained into those lymph nodes of the head and neck. And lymph vessel are like the veins. Okay, so they have valves, okay, like that of the veins. So this lymphatic vessel are quite similar with that of the veins. Okay, I think you have studied about those lymphatics, okay, lymphatic system in general, basic science. Okay, so in anatomy, I think you have been studied with all those points, I think. Okay, so this lymphatic drainage, just you should have to remember. Okay, so the lymphatic drainage, a lymphatic vessel accompany the blood vessels, and they just drain the lymph, drain to the lymph node of the head and neck, and they just drain, flow in the ligament, flow from the ligament towards the adjacent alveolar bone, and they are quite similar to that of the veins. After that, in the third content, that is a nerves. So we have particularly two different types of the nerve fiber, that is sensory and the autonomic. Sensory fiber is responsible for the nociception, mechanoreception, and proprioception. Nociception means the pain sensation, okay, and mechanoreception means touch, pressure, okay, and this proprioception. After that, this autonomic fiber associated with the PDL vessel. Okay, so autonomic means sympathetic, parasympathetic. Okay, so they are associated with the blood vessels. After that, our fourth content is the cementicles, and about the cementicles I have discussed properly in the cementum chapter. Okay, so but for now in periodontal ligament we will just study little bit, and this cementicles properly we will be discussing in the oral pathology. In the cementum chapter also I have not been haven't discussed more about the cementicle. Okay, as this is a chapter, a topic of the oral pathology, we will discuss this in more detail in the oral pathology. Okay, but for now we just have to remember a small concept, that it is a calcified body, and it is seen in the older individual. With the age it increases, and they may remain free in the connective tissue, or they may fuse into the larger calcified masses or join to the cementum. Okay, so either they can remain the free, or they can incorporate with the other large calcified masses, or they can be joined to the cementum. Okay, so I have also classified, I think, the cementicles, okay, that is free attached, okay, like that way, okay, in cementum chapter. Okay, so once you can visit that video too. Okay, after that, after the cementicles, we have last topic of this chapter, that is age changes. And in age changes, there is decrease in a cell and their activity. Also there is decrease in a collagen turnover and the elastic fiber, and decrease in the ligament width, and decrease with the decrease in a masticatory load in the old age. Okay, okay, so there is decrease in the cells, there is decrease in a fiber, there is decrease in a collagen turnover, there is decrease in a width of the periodontal ligament. Okay, so that is coming under the age changes of the periodontal ligament. Okay, so now we have completed all the topics of this chapter, and I think I have been able to explain all those points of this chapter, okay, in all those three videos of periodontal ligament. Okay, so if you are watching this part 3, then you should also watch the part 1 and part 2, so you will be getting the proper overview in this chapter. Okay, okay, so now we will meet in the next chapter of this dental histology. Till then, stay happy, stay healthy, and for the notes you can visit my telegram channel. I used to post all those notes in my telegram channel. So tata, bye bye, thank you.